Thank you for joining us today. We will begin by hearing from Austin Ramirez, who is our Business Continuity Branch Manager within our emergency response, about how we're providing food at our emergency respite shelters.
Good morning. Our restaurant community has been one of the hardest hit sectors of the COVID-19 pandemic. In an effort to protect the health of their customers and employees, many have modified service and made difficult decisions that impact their bottom line. We are incredibly grateful for their efforts and their sacrifices to protect the public health of our region. To provide food for people in need, while also generating revenue for these businesses that are impacted most, Lane County has partnered with Food for Lane County to work with local restaurants to provide food for the 2 respite shelters for the unhoused. Food for Lane County was unable to be here today, but they have provided the following statement. Food for Lane County is committed to creating access to food when and where it is needed most during this time. The food bank is adapting its programs and practices to make sure as many people as possible are being served safely. To protect employees from unnecessary exposures, Food for Lane County is limiting the number of volunteers working to serve key areas, such as Meals on Wheels. Right now, the best way people can help Food for Lane County is with a financial donation if you are able and willing to support this critical organization. I'd like to introduce Justin Freeman from Bagel Spirits, one of the many businesses partnering with Food for Lane County, to talk more about why this work is important.
Thank you, Austin. Thanks for having me here today. Frankly, this has just been an unbelievably hard past couple of weeks, as it has been for a lot of people. And I think it doesn't matter whether you're retired or working in food service or healthcare or education or even the media or a dozen other industries. These are difficult in different times. We're in food service at Bagel Spirits. It's what we do, and we're here today, as Austin said, as partners with Lane County and Food for Lane County in serving our local homeless community during this pandemic. And they wanted me just briefly to share why we felt this was important to participate. And even in general times, I like to tell our bakery staff that life is like a stool, and we're each sitting on our own stool, and there's a leg for each aspect of our lives: our health, our finances, our job, our friendships, family, housing, and so on. And the more legs that are strong and in good shape, the easier it is to balance and maintain stability in your life. In fact, if you have enough strong legs on that stool, you can persevere when one of the other legs is knocked out. So if something goes wrong in your finances, for instance, you could rely on the stability from your job, family, and friends to help you weather it. Well, these past few weeks, most of us in the community and in the country and also worldwide have had multiple legs kicked out from under us simultaneously. Jobs and finances being lost, housing at risk, separation physically from our family and social support structures, and most predominantly in this pandemic, our health is at risk. And it makes it awfully hard to balance on a stool like that. Now, our neighbors in the homeless community came into this pandemic with multiple legs of their stools already weakened or at risk. Before coronavirus entered our community, they already experienced a lack of housing, food insecurity, a lack of local family or social resources, and underlying health problems for some of them. And I would argue that these people are at some of the greatest risk of disruption and potential harm due to the coronavirus. And so the county and Food for Lane County's move to set up temporary respite shelters during this time provides housing, predictable food, and a safe social environment. And for us in food service, being able to contribute and provide economical and nutritious meals to help serve these ends is simply the right thing to do. And it's one of those intersections where business and public policy can partner together to promote social good. So we really believe in this project and what the county and Food for Lane County and all the volunteers are trying to do. We're glad to be a part of the effort in our own small way, taking our expertise in feeding people and using it to provide stability to our local homeless population as they endure this pandemic alongside the rest of us. Thank you.
Thank you, Justin, and thank you, Austin. Certainly one of the most significant reasons why Lane County is such a great place to live, work, and play is our local businesses, and seeing the way they have stepped up around this effort, specifically for the unhoused community, is proof in the pudding of that. So thank you again. First, I'd like to start off with a case update. We now have 21 positive cases here in Lane County. 710 tests have been sent from Lane County to our area labs. We currently still have 4 recoveries that have been reported back to public health. We have 6 individuals who are still in the hospital. We have 10 who are sick at home, and of course, we still have 1 fatality. Of our new cases, we have a woman in her 50s who is from rural Lane County. She is at home and communicating with public health. We have a man in his 20s from the Eugene Springfield area. He was hospitalized and has now since been discharged and is recovering at home and communicating with public health. We also have a male in his 50s. This is our most recent case. This gentleman is currently hospitalized in the ICU and intubated. He is from the Eugene Springfield area, and certainly a hard time for him and his family, and our thoughts go out to him. I was talking with our health officer earlier about our testing numbers, and first of all, acknowledging the fact that those testing numbers are not comprehensive, that really our testing numbers are likely higher. So with 21 positive cases, what does that high amount of negative tests tell us? And while, of course, we would like to claim an element of victory in that, that wouldn't be accurate. We do know that there is more coronavirus, more COVID-19 in our community than we know about. But it does tell us a few things. One of the more important things that it tells us is the fact that there are other illnesses that are causing COVID-like symptoms in our community. Things like adenovirus, rhinovirus, seasonal allergies, and influenza are absolutely still causing some of those upper respiratory and at times even lower respiratory symptoms. I don't say this to discount the overall amount of concern that we should have around coronavirus, but moreover, just to highlight the fact that as you're self-evaluating your symptoms and paying attention to your personal health, that you take into account that we still do have a significant number of other respiratory conditions that are circulating in our community. I'd like to also announce that the investigative guidelines around how we do investigations for COVID-19 have changed. And the most significant part of those guidelines that I want to announce to you is the fact that now we're looking back for, with the symptom onset date, 2 days before that date. So if someone started noticing COVID-like symptoms on the 9th of March, then we would go back to the 7th in terms of looking into the public contacts they may have had or any personal contacts they may have had. We believe that this is going to really expand the amount of investigation that's happening and allow us to better respond and better get a handle on what's happening in our community. It's important to also acknowledge the fact that these are guidelines that are being handed down from the Centers for Disease Control in an effort to look at our entire country and how we are reacting to COVID-19. I also have seen quite a bit of communication out there, both questions coming into us, conversations happening amongst our clinics around the guidelines and why they change. Certainly during a natural disaster or another evolving event where there is a large public response, you do see that note that the situation is likely to change, and as the situation changes, so will the information. Well, the COVID-19 emergency response and the guidelines around COVID-19 are exactly the same. That as we learn more about this virus, as scientists and medical professionals are able to glean information from various responses across the globe, that information is being vetted and then informs the guidance and the recommendations that we make to the public. So it's not necessarily always that there's mixed messages, but moreover that we're seeing an evolution of the amount of knowledge that we have on coronavirus. So please keep that in mind as you're evaluating the information that is in front of you and as you see these guidances change. Also, I would like to just comment briefly on our timeline. And so what we're still seeing on our disease timeline is a very slow curve. It's not a steep curve like this, it's more like this. And I want to explain why that matters. The longer that we can maintain a gradual curve and not a steep curve, we are actually building a certain level of community immunity. As our bodies take in various amounts of COVID-19 through community transmission that is inevitably happening, even with social distancing, collectively we are building some level of immunity. We are in a very fortunate spot here in Lane County, having been late in the game, so to speak, with the overall national outbreak. And that is what is affording us really that opportunity to build a remedial level of community immunity. Also, you may have noticed a change on our website around cloth masks or homemade masks. And so this is not an official recommendation from Lane County Public Health, and nor is it a reflection of changing recommendations from the CDC. This is really just acknowledging a potential use for these kind of masks. And so what that use really is around sick people, preventing those large droplets from being sprayed out of their mouth or nose. That those cloth masks, those homemade masks, especially if they have a vapor barrier sewn into them, and so that's an extra layer sewn in there that acts as a shield for those large droplets, can be effective if worn by sick people within a household. So if you have, let's say, a parent who is sick, them wearing the mask within the house can be a way to prevent those large droplets from being in the air more readily. They can also be a good measure to take if you're a sick individual that absolutely has to leave the home for a doctor's appointment. That would really be the only reason for an individual who is sick to leave the home, and so putting on one of those homemade masks can help protect others around you. So we just wanted to highlight that and make that known that we are acknowledging significant use for those homemade masks, but it's really relegated or intended to be for those at-home scenarios. Also, we received some questions about mental health yesterday. I had indicated that we have resources on our website, and we do. I just wanted to call out a couple facts about those resources. Number one, after talking to some of our mental health professionals, they wanted to highlight the fact that if you are currently receiving mental health services through a mental health provider, that really is still your best way of accessing services. If you have a primary care provider and have not accessed mental health services, you can also work through your primary care provider to find out what the best way and resource is for you. If you don't have mental health resources or have not received mental health resources, the Whitebird Crisis Line is a great way to call into a local resource and find out what could be available for you, and also just to have a caring voice on the other end of the line who can help listen to what you might be going through. Additionally, the Substance Abuse and Mental Health Services Administration, or SAMSA, has a disaster distress helpline. And so that helpline can really be an effective way for individuals who are experiencing a high level of stress or anxiety right now. The number for that line can be found on our website. I will give it to you briefly here. It's 1-800-985-5990, or you can text Talk With Us to 66746. The Whitebird Crisis Line can be reached at 541-687-4000 or 1-800-422-7558. Finally, I'm going to touch on another thing that we have been seeing floating around, some rumors about the governor's orders or potentially some miscommunication in there. So folks have started to notice that some of the governor's orders are dated out to September 30th. And the anxiety around potentially those orders really being intended to be for that lengthy time has started some conversations. And we just wanted to point out the fact that post-dating the governor's orders and other directives is really a common occurrence. It happens both in times of emergency and in times of or normal times, really as a way to remain flexible and reactive as a situation changes. So the intent really isn't to really look at everything that's in place right now extending out to September 30th, but really to have the flexibility within that time frame to react accordingly. So we just wanted to make that known. And at this time, I'll take any questions from our media. I will take the public health questions first, and if you have questions for Justin or Austin, we will take those after the public health questions.
So Rachel from KLCC would like to clarify that those who are healthy don't need to wear masks at the grocery store or other public places.
So Rachel from KLC would like some clarification on whether or not individuals who are healthy should wear a mask to the grocery store or other public places. And thank you for that, Rachel. That's an important clarification. And still, the guidance is that people who are healthy should not wear a mask in the community. Now, if we're talking about N95s, there's a couple reasons for that. Number one, N95s, in order to be effective, and those are those masks that have that additional extra filter on them, they need to be fit tested by a professional. You also can't have facial hair. And so those are two important factors that might not be readily known by the public. But if they're not professionally fitted to your jawline, then they won't form a seal, and that's really where the protection comes in. Also, folks tend to use those masks for a lengthy period of time, and as we know, as time goes on, they degrade. And so you would need a constant supply. Now, if we're using a constant supply of N95s, we're taking those away from healthcare professionals who need those really to protect themselves so that they can provide and continue to provide the level of care we need in our community. So that's one of the reasons for the N95s, for healthy people not to wear those. The surgical masks are not an effective way to prevent contracting COVID-19. They don't have the proper filters in place to be able to filter out the tiny viral particles. What they can do, though, is if you're sick, you're sneezing, you're coughing, and they can act as a barrier to prevent some of that moisture that's coming out of your mouth or nose from reaching into the air and to people around you. So that's really the best way to use those.
Follow up, what about those with pre-existing conditions or who are elderly?
So the follow-up question from Rachel is, what about individuals with pre-existing conditions or the elderly who might need to go out into the community? And so those individuals, we urge them to have a conversation with their primary care provider, and their primary care provider can provide directions specific to their condition and find out whether or not that's a viable resource for them to utilize if they need to go out in the community. I think it's important, though, for everyone to really fall back on the guidance around staying home, though. We are trying to design ways to keep up life as normal, and this is not life as normal. And the message really is stay home, save lives. So please have that be your first fallback.
Question from Brian at KEZI. Rumor is floating around that somehow COVID-19 is tied to 5G technology. What does the health department say about that?
So this is from Brian at KZI, and he says there is a rumor going around that somehow 5G technology, so that's that cell technology, the next level up in, I'm not an expert at 5G technology, but better reception and greater data capability, is somehow tied to COVID-19. And I have not seen a shred of scientific proof on that matter. I think what we are seeing here is an example of a beta coronavirus that is common to the world, those beta coronaviruses. And I think we have a lot of understanding about how beta coronaviruses have moved through the globe and where they come from. And really, that's an animal reservoir, not a cell technology. And that's all we have. If members of the media have any questions for Austin or for Justin, you can pose those now. Otherwise, I will clean the podium and we will catch you tomorrow.